Hello, welcome to Beatrice Weekly Health Tips. Today I'm going to talk about anemia. It's a big subject. I've seen a lot of blood tests, and a lot of people suffer from anemia and don't even know it. Why is that? Well, first of all, there are several categories of anemia. It's not just the lack of iron that can give you an anemia. Of course, beside the lack of iron, you could have, for example, enough iron, but it's not distributed correctly into your cells. Or you could have a lack of vitamin B. If you're lacking B12, you may have a certain form of anemia that we call Megaloblastic Anemia. You could also lack B6 or B9. Any of these deficiencies will lead to some type of anemia. And you will feel the fatigue and pale skin and inside the eyelids, shortness of breath, etc., that you do feel if you have a lack of iron. Anemia can also be present in chronic disease when you have chronic inflammation, for example, in a cancer situation. Any other type of chronic inflammation can give anemia. You could have another type of anemia that is autoimmune, and that's not rare. This is called pernicious anemia. And pernicious anemia is when your body is attacking its own red blood cells. So of course you're going to have a low count of red blood cells, and you will have all the symptoms that I just mentioned. And of course you can have an internal bleeding and not knowing it. Example of an internal bleeding could be an ulcer, it could be hemorrhoids, but also could be ulcerative colitis, Crohn's disease, something like that, where you don't lose a lot of blood at a time, but a little bit drop by drop, but constantly. So why do we have so many types of anemia, and why do we have so many people that are anemic? Many years ago, before I knew what I know now, I would look at a blood test and see that people were deficient in iron or B12 or B6, and I would just give them these replacement. So that sounds easy to fix. The problem is that if you just do that, when you take a blood test a few months later, like 2 or 3 months after, you'll see that it's better in the blood test. But if you stop taking these supplements and you do another blood test 6 months down the road, you'll see that in fact you're anemic again. So you've not fixed anything. You just use the Band-Aid politics, which is what Western medicine is doing, and which is what I do everything I can to not do. So there are many reasons behind these anemia. The first one is, of course, nutritional deficiencies, because our food is not as rich as it used to be. Are you eating calf liver or chicken liver every week? I don't think so. The majority of people don't. Since I moved to France, I tend to do that because it's readily available and I love it. Absolutely love it. I just had one for lunch. That's probably what prompted me to talk to you about anemia today. But when you eat liver, you have a food that is rich in B12, B6, B9. It's rich in iron. It's rich in vitamin A and vitamin D if the animals has been raised on the pastures. So it's one of the richest type of food you can consume. And with the stressful lifestyle we have, with the lack of nutrients that we find in fruits and vegetables and even in the meat, I think it's mandatory for people to eat at least once a week some type of organ meat, specifically liver. Then there is the red meat problem, which a lot of people in France are very, very shy to eat. They're really afraid of the red meat because of the way the red meat is raised, which is a true concern between the slaughterhouse that really are mistreating animals and the way these poor animals are raised, I really believe that the quality of red meat has gone down so much. In the 20 years that I lived in the US, I saw the quality of meat and food in general go way, way, way down in France, and it's very disappointing to me. So we have nutritional deficiencies, we know that, but I think the biggest reason why people are anemic nowadays is because they have leaky gut syndrome. We absorb our nutrients, as you know, through the small intestine. But if that small intestine lining is compromised, you're not going to absorb your nutrients properly, and you're going to absorb things that you should not absorb, like heavy metals or bacteria, viruses, whatever, parasites. So I really have realized that giving supplements to people was not enough, because as long as we don't fix the gut, as usual, it always comes back to the gut. If you don't fix the gut, you can't absorb properly, and you're going to leach out your nutrients even if you eat very well, very good quality of food, which is rare nowadays. So in order to fix your chronic anemia, I've seen people that come with blood tests, and as you may know, I'm kind of a nerd as far as blood tests. I make a graph, I analyze everything from 1 year to another, I make a comparison. And I see people that are anemic year in and year out, and they're anemic since they're like 12 or 15 or 10 or whatever. Doctors are telling them, well, it's just the way it is, your body is built like that. I agree that we all have different bodies and we're built differently, but being anemic is not normal. That's not built in. That is acquired. And even if you're 10 years old, it has been acquired for a reason. And maybe it is because you had too many antibiotics, too many steroids, too many vaccines with too many heavy metals. Bottom line is, it has damaged your gut lining, and because of that damaged gut lining, you now have anemia. So we need to repair the leaky gut. And in order to repair the leaky gut, we need to focus on gut flora. Nourish, 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 nourish your gut flora. Eat fermented food, kombucha, kefir, sauerkraut, kimchi, fermented vegetable juice, whatever you can eat that is fermented, please eat it. This is our saving grace. This is how we can turn around our state of health, which I believe is going down. But if we want to turn it around, and if we want the next generation to be healthier than we are and live longer, we need to feed these babies with this food. Then you need, of course, to work on heavy metals, reduce it, remove them, and clean up all your personal hygiene product, the household product, everything that is toxic. As you go through your list of product that you use, just replace them with simple baking soda, lemon juice, vinegar, etc., to make your own laundry soap, to make your own soaps, to make your own lotion to put on your body. So a blood test indicates anemia. That's really the best place to look for it. When you check for that, if you have a suspicion of anemia, you need not only your iron level, but you need iron saturation, you need the ferritin percentage, and you also need to look at your vitamin B. Like I said, B6, B9, B12, that's the minimum. And of course, in a blood test, you will have red blood count, you will have hemoglobin, you will have hematocrit, and then you will have the width and the color and the volume of your red blood cells. All these count. It's not just one marker, it's the whole picture. Looking at a blood test result is like looking at the whole person. I don't look at one marker isolated from another. I have been taught to look at the whole picture and see if there is a scenario, if there is a story that makes sense that is transpiring through these blood test results. This is also why I like to have several blood tests to compare them, because one day you may be fighting an infection. Another day, maybe you're a woman and you had your period and you bled a lot. So you need to have a little history in order to understand really if you have some sort of anemia or not. That's all I have to say about that for today. I thank you very much for your attention, and I'll talk to you in another podcast. Bye bye.